Prediabetes is a serious health condition where blood sugar levels are higher than normal, but not high enough yet to be diagnosed as type 2 diabetes. Of the 96 million American adults, more than 1 in 3 have prediabetes. Of those with prediabetes, more than 80% don't know they have it. Prediabetes puts you at increased risk of developing type 2 diabetes, heart disease, and stroke. The good news is that if you have prediabetes, diabetes prevention programs can help you make lifestyle changes to prevent or delay type 2 diabetes and other serious health problems.
Insulin is a hormone made by your pancreas that acts like a key to let blood sugar into cells for use as energy. Your pancreas makes more insulin to try to get cells to respond. Eventually, your pancreas can't keep up and your blood sugar rises, setting the stage for prediabetes and stage 2 diabetes down the road.
You can often have a pre-diabetic for years, but no clear symptoms. So it often goes undetected until a serious health problems such as type 2 diabetes shows up. It's important to talk to your doctor about getting your blood sugar tested if you have any of the risk factor for diabetics, which includes being overweight, being 45 years or older, having a parent, brother, sister with type 2 diabetics, being physically active less than 3 times a week, ever having gestational diabetics.
Using our risk assessment on our site, you can check your risk towards prediabetes. The tool is very free and very easy to use. All you have to do is answer a few questions and the app will calculate your risk of prediabetes. A high score on the online risk means an individual has a significant risk of having undiagnosed prediabetes or type 2 diabetes. However, only a blood test can determine a diagnosis.
You can get a simple blood sugar test to find out if you have a pre-diabetic. The A1C test measures your average blood sugar level over the past 2 or 3 months. An A1C below 5.7 is a normal. Between 5.7 and 6.4 indicates you have a pre-diabetic, and a 6.5 or higher indicates you have a diabetic.
People with prediabetes have a high risk of heart disease and stroke. The risk of serious health problem increases even more for people with diabetes. Diabetes affects every major organ in the body. People with diabetes often develop major complications including kidney failure, blindness, and nerve damage. Nerve damage can lead to amputation, removal by surgery of a toe, foot, or leg. Having diabetes can also double the risk of depression. That risk increases as more diabetes-related health problems develop. All can sharply reduce the quality of life.
Metformin is a medication that is prescribed for prediabetes. Metformin does not cure prediabetics. It only controls the glucose level in the blood and helps to prevent type 2 diabetes. It is taken by mouth orally in the form of pills. Like other medication prescribed for prediabetics, metformin works best when you have a nutritious food like having more of fruits, more of vegetables, and ensure you stay active, physically active every day. And always it works better by losing weight.
Prediabetes as a fork in the road. If you ignore it, your risk of type 2 diabetes goes up. Lose a modest amount of weight and get regular physical activity, and your risk goes down. Modest weight loss means 5 to 7% of body weight for a 200-pound person. Regular physical activity means getting at least 150 minutes a week of brisk walking or similar activity. That's just 30 minutes a day, 5 days a week.
Prediabetes is a condition in which the blood glucose is high, but not high enough to be called type 2 diabetes. Without intervention, it is likely to become type 2 diabetes within 10 years. Most people with prediabetes have no symptoms, but with lifestyle changes, weight loss, and dietary modification, it is possible to bring the blood glucose back to normal. Instead of red meat or processed meat, go for poultry and fish. Instead of over-processed carbohydrates like white bread, potatoes, and cereal breakfast, go for whole grain or whole grain products like millet, corn, oats, brown rice, or wheat. Instead of margarine, baked foods, or fried foods, go for good fats like those seen in vegetable oils, seeds, and in nuts. Instead of sugary foods, stick to decaffeinated coffee, tea, and water.
Prediabetes is a condition which is characterized by slightly elevated blood glucose levels, which is regarded as indicative that a person is at risk of progressing to type 2 diabetes. It is not necessary that everyone with prediabetes will go on to develop diabetes. Over a short period of 3 to 5 years, about 25 to 30% people can develop full-blown diabetes. Pre-diabetes is common and most importantly, it is reversible. As is said, prevention is better than cure. One can prevent or delay pre-diabetes from turning into type 2 diabetes with simple and proven lifestyle changes, dietary restrictions, regular walking exercises, etc.